Welcome to our 5 on 5. Pleased to be joined today by Dr. Mark Greenberg. We're from Advanced Pain Care. Dr. Greenberg, good to see you. Thanks for being here.
Thank you for having me.
So we're here to talk about the opioid crisis going on in Oregon and across the country. What do you think is the root of this crisis?
Well, I think it's a complicated problem. It first came to the public attention and the medical community's attention back in the early 90s when there was a realization that we really were not managing the problem of chronic pain in an effective way, and that this was an important medical condition that was affecting people's lives. Unfortunately, at the time, there was a big push to use opioid-type medications in a more liberal fashion, and that has gotten us to the place that we're at today.
Okay, and you know, this is a problem, as we know, in probably all 50 states across the country. What are some of the latest studies talking about related to pain management?
Well, one of the problems that was at the foundation of the opioid crisis was that we didn't really understand that acute pain and chronic pain are completely different medical conditions. And opioid medications have a high degree of effectiveness for acute pain, meaning pain from a specific and recent injury or surgery or a situation such as that. Chronic pain is pain that persists over a long period of time despite the initiating event resolving. And we conflated those two conditions together, and that led to the use of opioid medications commonly for the treatment of chronic pain. However, we didn't really have data and studies to back up that utility. Recently, some of the first studies, in fact, that have looked at the use of opioids for chronic pain over time have come out. And what they have shown is something that the medical community has sensed for a long time, is that opioid medications are actually not that effective. Moreover, they have very significant risk of addiction, habituation, and side effect. So we're stuck with this treatment of low utility, high negativity, and high degree of societal problems that we're seeing now, what is known as the opioid crisis. Okay. And we have to deal with that.
All right, we're going to take a quick commercial break. We'll have much more in just a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with Dr. Mark Greenberg from Advanced Pain Care. So we're talking about the opioid crisis across the country, not just Oregon. What kind of treatments for chronic pain are available that don't rely on opioids or surgery?
I've certainly spent a lot of time and effort looking for treatments that don't use opioids. In my practice, I look at various regenerative treatments, things that help things to heal, help things to grow, to resolve old injuries without relying on medications, while traditional treatments such as physical therapy, acupuncture, psychological support are all important adjuncts to treating chronic pain. I think that there's more out there, various types of injections, various types of interventions that use substances that are both from the patient's own body as well as other natural substances that, when used properly, can be very effective at treating chronic pain.
Okay, and what do you think is needed to help patients get through the current crisis?
I think that patients need to be educated that there are alternatives to opiates and that there are other places to look for treatment other than to medications that can be very helpful for these debilitating conditions.
Okay, and the Oregon Pain Guidance Group, what exactly is that?
That's a group of local physicians that have gotten together with the realization that opioids are not a very good treatment for chronic pain, and that we have a crisis that's developed around their use. And basically, it was set up to educate local doctors as to proper use of opiates and, in some instances, what those alternative treatments are. So it's a local educating group of physicians.
Well, we are all aware that it's a huge problem. We appreciate the work you're doing. Thanks very much.
Thanks so much.
All right, stay with us. We'll be right back.